Hear that? Yeah, that's the sound of you relaxing, because now you're managing diabetes with the Freestyle Libre 3 system. You get to know your glucose levels and where it's headed. Manage your diabetes with more confidence with the Freestyle Libre 3 system. Ready to learn more about the #1 prescribed CGM in the U.S.? Visit freestylelibre.us to learn more. Based on retail sales data for patients' last filled prescription by manufacturer. Refer to the FLAIR NL4 study published in BMJ Open Diabetes Research and Care 2019. Safety info found at freestylelibre.us.
Hello and welcome to Bytes of Health, where we hope to take a bite out of your parent worries each day with sound advice and guidance. Every morning, we'll answer a commonly asked question in 5 minutes or less. I'm your host, Dr. Jess Steyer, public health scientist and mom of 2 kiddos. And today we are going to talk about flu shots, because 'tis the season. The clock is ticking, so let's get to it. So why are flu shots important for children? Flu shots are crucial for kids for several reasons. 1, they significantly lower the chances of severe illness, hospitalization, and flu-related deaths in children. And yes, although rare, this can and does happen. Kids, especially those under 5, are at higher risk of flu complications like pneumonia, dehydration, and worsening of existing medical conditions. Vaccinated children also help prevent the spread to vulnerable populations. So this includes infants who are too young for vaccination, elderly family members like grandparents, and those with weakened immune systems. Vaccination can reduce school absences and disruptions to learning. And even healthy kids can become seriously ill from the flu. During the 2019 to 2020 flu season, 199 flu-associated deaths in kids were reported to the CDC. Can kids with egg allergies get the flu vaccine? Yes, kids with egg allergies can safely receive any approved flu vaccine. So the CDC and the American Academy of Pediatrics recommend that kids with egg allergies receive any licensed age-appropriate flu vaccine. This includes those that are egg-based. For those with severe egg allergies or a history of egg allergy reactions, these kids can safely get any flu vaccine, including those that are egg-based, but the vaccine should be administered in a medical setting capable of managing severe allergic reactions. Now, for those still concerned, even though deemed safe, there are egg-free flu vaccine options available, such as cell-based and recombinant flu vaccines. So what's the flu mist and who can use it? So the flu mist is a nasal spray vaccine that offers an alternative to the traditional shot. So this is needle-free, but it's only approved for healthy individuals aged 2 to 49 who are not pregnant and not immunocompromised. It's particularly useful for kids who fear needles, which could potentially increase vaccination rates. Again, it is not recommended for kids under 2, nor is it recommended for adults 50 and older, those who are pregnant or those with certain medical conditions. How can parents help kids overcome fear of needles for vaccines? Now, overcoming needle phobia is really critical for maintaining preventative health measures. So open communication, you want to be honest about what to expect, but frame it positively. Use deep breathing, counting, or watching videos during the shot. While the American Academy of Pediatrics does not specifically recommend numbing creams, they do suggest discussing pain management options with your pediatrician. Some doctors may recommend over-the-counter options like lidocaine patches or creams in more severe instances of needle phobia. You want to offer praise and small rewards after vaccination. Stay calm yourself, as children often mirror their parents' emotions. Explain the importance of vaccines in an age-appropriate way. So discuss how vaccines protect not just the individual, but also the community, including classmates, family members, and those who can't be vaccinated. Use this as an opportunity to teach them about preventive medicine and how it's easier and more effective to prevent diseases than to treat them. And you can give them some control by letting them choose which arm to get the shot in, or what distraction method to use, or what type of Band-Aid they want to use after getting the shot. Can kids get the flu and COVID vaccines at the same time? Yes, simultaneous vaccination and timing are important considerations, and you can absolutely co-administer both vaccines at the same time. This can reduce the number of healthcare visits and will increase the likelihood of being fully vaccinated. So this is definitely a good idea. Now, the CDC recommends getting the flu shot anytime now or through the end of October, but let's say you miss the window, getting vaccinated later is still beneficial, as flu season can last even through May. Flu activity typically peaks between December and February in the US, and just note that it takes about 2 weeks after vaccination for antibodies to develop and provide protection. All right, well, I hope you learned something today, and remember, we have lots more to share. You can get your dose of Bytes of Health every day, Monday through Friday. If you like what you've heard here, please let us know. Leave us a review and be sure to tell your friends. Remember, there is no single way to parent. Parenting is a journey, and we are all just doing our very best. We wish you happy, healthy, and stress-free parenting.
From the terrifying power of tornadoes to sizzling summer temperatures, AccuWeather Daily brings you the top trending weather-related story of the day, 7 days a week. You can learn a lot in just a few minutes with stories about impending hurricanes, winter storms, or even what not to miss in the night sky. So listen and subscribe to AccuWeather Daily wherever you get your podcasts. That's AccuWeather Daily wherever you get your podcasts.